I'm going to talk this morning about a problem that Dr. Motri alluded to very nicely, and that is the problem of severe autism and behaviors associated with it. And there are a lot of behaviors that are problematic, in particular with children with severe autism. And those include aggressive, self-injurious behaviors, severe repetitive and stereotype behaviors, and severe hyperactivity, as well as some other problems that are common in autism across the spectrum, sleep disturbances, anxiety, and things like that. But some of the problems that children have with aggression and self-injurious behaviors and extreme hyperactivity and repetitive behaviors are so severe that they interfere with their lives. They interfere with all aspects of their lives, including home life, social life, academic life. And there are very few treatment options for those kinds of behaviors. The mainstay of treatment is behavioral therapy, which certainly helps to an extent, educational intervention, and then medications. And there are only a couple of medications that are approved for the treatment of these behaviors. And they do not work with every child, and they often have somewhat unpleasant side effects. People have, in recent years, been very interested in the role of cannabinoids in the treatment of some of these behaviors. Cannabidiol, CBD, is the one that has really been focused on the most, although there are other cannabinoids that are being looked at as well. Phytocannabinoids are substances that come from the cannabis plant, and the most well-known is THC, delta-9 THC, or cannabis, and this is the main psychoactive cannabinoid. And cannabidiol, which is a non-impairing cannabinoid, we used to say not psychoactive, but it does have psychoactive properties. They're just beneficial ones, at least people think. So they're non-impairing cannabinoids. And cannabidiol makes up about 40% of the cannabis plant. So it's present in good quantities. And we don't know as much about these drugs as it would be nice to know because of legal restrictions until relatively recently. But the mechanisms for CBD are really multifactorial and complex. They're not just they work on one receptor or something like that. They have a lot of mechanisms with possible effects on various neuroreceptors in the brain, various neurotransmitters, and possibly in mitochondrial function. There is a recent study in a mouse model of autism looking at CBD effects and showed benefits on repetitive behaviors and anxiety, but not any improvement in social deficits in that mouse model. And this study showed that there were changes in mRNA expression in several neurotransmitter-related genes post-treatment. So there's really a lot of effects on the brain chemicals that carry messages around the brain and also modulate brain function and also work on neural circuits, which are important problems in autism. We know that cannabinoids do have some therapeutic roles that have been documented, most importantly in the treatment of intractable epilepsy, and also have been beneficial in treating nausea and vomiting associated with chemotherapy, and to some extent in treating weight loss associated with HIV infections. There are other areas that it doesn't seem to be effective, and we don't know whether it's effective in autism. But there's been a lot of interest in it because of its reported effect on anxiety and possible social improvement. There have been some adverse events of CBD identified primarily from epilepsy studies, and these include insomnia, nausea, diarrhea, vomiting, dry mouth, a lot of milder problems. And then more serious are elevation of liver enzymes, which could lead to chemically induced liver injury. So it's not benign, and it really is important to see whether it has any effect. And there have been a number of studies published over the last 3 years or so that suggest that there is a positive effect on behaviors in autism. So there have been a number of open-label, uncontrolled studies, meaning that the family and the patient knew what they were getting. They were all getting CBD of some sort. Most of these were observational studies. So the family wanted to use CBD. They went out and bought CBD and they used it. And then the physician or clinician who was studying what they were doing asked them to complete questionnaires after they had been given the CBD that they were taking. So really uncontrolled studies, because you can buy 50 different brands of CBD and have 50 different things in those bottles. And so there was really no control. But based on those studies, they did feel that there was an improvement in anxiety, communication, and disruptive behaviors in about almost 2/3 of children with autism treated with CBD. And most of those were CBD to THC ratio of 10-1, which is relatively high, and in some instances was associated with actually the children having a bit of a high from the THC component. In more recent studies, there have been several, again, a prospective uncontrolled study using parent questionnaires showing that 30% had a significant improvement and 54% a moderate improvement in restlessness, rage attacks, concentration, and mood. Interestingly, the reported side effects in this study were primarily sleepiness, lack of appetite, and restlessness. And there have been a couple of more recent studies, but they're basically the same. Now, this more recent one in 2021 showed a different effect using 2 different formulations, and they did not find good evidence of efficacy in treating the targeted behaviors. They did not find a significant difference between the groups in most of the behaviors that they were looking at. So mixed results with studies that were not well controlled or not controlled at all. Now, I told you a couple years ago at this meeting that we were starting this study, double-blind, placebo-controlled study, crossover study of severe problem behaviors in children with autism. And we've just finished the study. We started it at the beginning of the COVID pandemic, finished it as masks were starting to come off in July this year. So went through a lot of challenging times with the study, and we are just starting to analyze the data. So that's still all in various levels of analysis. But the study was aimed at targeting the most severe and pervasive behaviors. And we used a highly purified plant-based cannabidiol with a very low concentration of THC. And this is Epidiolex, which is the only approved, FDA-approved CBD preparation. And that's the one that's used for treatment of epilepsy. And the goal was to achieve or obtain objective indicators of improvement as well as subjective indicators of improvement. We used a multi-modal assessment approach with parent observation, clinician observation, and then objective measures including neuropsych testing, neuroimaging, and electroencephalography. Our primary outcome measures were looking at aggressive behavior, self-injurious behaviors, severe, pervasive, repetitive, and perseverative behaviors, and stereotypies, and extreme hyperactivity. And by extreme, I mean this is the level where a child cannot sit still and focus for more than seconds, a few seconds, all day long. These are not mildly hyperactive children. And we had some secondary outcome measures as well, looking at anxiety, sleep disturbance, social interaction, eye contact, social communication, and language. So as I said, we did use direct neuropsychological testing and parent questionnaires and did eye tracking, EEG, and neuroimaging. So this is some demographics and information about the participants in the study. We screened initially about 200 children, but detailed screening in 57. We ended up randomizing 44, and 30 completed the 20-week study. It was 2 phases. The children were tested at baseline. They then were randomized to either placebo or CBD. They took that for 8 weeks. They were retested at 8 weeks and then taken off whatever they were on. There was a 4-week washout period, and they crossed over to whatever they hadn't been on the first time, and then took that for 8 weeks, were tested again, and then came off of that. So there were some children who were ineligible for the study after we had screened them and thought they were. Nothing exciting about the reasons. And then 4 who decided they weren't interested in the study. We excluded any children who had a known genetic disorder that accounted for the autism. We excluded children with epilepsy, children with any other health issues that might be significant or might interfere with the study. We could not use children where we couldn't get any blood draw. One of our children that we had randomized initially went on an anticonvulsant medication by their primary doctor, and so they could not be in the study. This study was all male. There was a specific reason for that. The plan was to do an all-male study and an all-female study separately, and not to combine the data from males and females, because the presentation of severe autism is different in males and females. Not just severe autism, the presentation of autism is different in males and females, and that's just starting to be better recognized, and there are a couple publications now on that. But we felt that it might dilute our results if we tried to look at the same parameters in males and females together. So the plan was, as I said, to do separate studies. This will report on the study in males, which has been completed. The age range was 7 to 15. And as you can see, ethnicity, we had a good mix of Hispanic and non-Hispanic, and a good diversity in racial representation. We had a number of adverse events, 44 while on CBD and 33 while on placebo, but importantly, no serious adverse events. These are some of the adverse events. Insomnia and difficulty sleeping was the most commonly reported side effect, more so in CBD than in placebo. Increased appetite was also common and present in both groups. Diarrhea and loose stools was really appeared to be a CBD-related side effect primarily. Increased self-injurious behaviors. It's only the placebo group that had an increase in self-injurious behaviors. And then elevated liver function tests, not surprisingly, we did find in a few patients. And then in very small numbers, other problems. Several of our patients developed COVID while in the study. And then we had just one child in each group who had increased appetite, sleepiness, itchiness, rash, and constipation. And then clearly unrelated, well, at least we think they're unrelated, adverse events, a dog bite, a piece of glass stuck in the foot, and a sponge stuck in the nose, and a seizure, a new onset seizure, interestingly, was in the placebo group, and one human bite. So even though those are unrelated to the drug, we do report these as adverse events because they happened during the study. So as I said, our data are still being analyzed, and we really don't have a lot of numbers to report, but just to give you a hint of what's to come or what we're finding. So the study participants tolerated the oral CBD very well. They all were able to take it. That was one of the concerns. A lot of the children all of them were extremely picky eaters. A lot of them were averse to certain tastes and textures, and so there was a concern among some of the parents that maybe they wouldn't take this medication, but they did. They all did, and we got measurable blood levels in all of them, and I just showed you the side effects. But this is the mean blood level. It doesn't tell you anything except to show that the first peak is the group in the first 8 weeks who was on CBD. And what you can see is that the blood levels rose pretty quickly and then stayed stable for the 8 weeks and then dropped down over the course of the washout period. But they didn't drop down completely to zero. And what we found was that there was a little bit of CBD still present in the blood at 12 weeks after 4 weeks of washout in some of the children. It was a very low amount, but still it was measurable. And this is interesting and important because it may affect our results of our crossover study because some of the children they still have CBD in the system during the second 8 weeks. The second peak to the right shows the second 8 weeks of the children who were on CBD. They had no CBD in their blood from the beginning till 12 weeks, and then they peaked and stayed pretty stable until the 20 weeks. So we were able to measure that. And then one of the things that we did was clinical impressions. So these are clinicians who were seeing the children. We saw them every week to every other week during the study. So this is like a clinical global impression of change, basically. What we noticed was that there were 2/3 of the children who completed the study, so 20 of the 30, showed measurable or notable improvements based on clinician ratings. And the remaining third either showed no change, no detectable change that we could see, or in one or two cases were a little bit worse. Now, the problem with that is that there were really a lot of variables that may have affected these changes. Some of the children had COVID infections during the course of the study, so we're going to be looking at that, whether that made any difference in terms of their behavior changes. And some were going back to school at the end of the study after having been home for a year, being homeschooled because of COVID. So it really complicates the picture some. But again, because of the design of the study, we had both placebo and active drug treated children at the same time, in the same time frame. So if going back to school made a difference, we should see it in both the placebo and the CBD groups. We had actually more kids in the placebo group had COVID infections than in the CBD group, so it's hard to compare that. But at least our CBD group didn't have very many COVID infections, so we were able to look at their within group differences. So for the primary outcome measures where we used questionnaires or tester-administered tests, our statistical analyses are really detailed and complex, and currently using mainly mixed effects models with subject-specific random effects and fixed effects for treatment, CBD or placebo, treatment duration, their interaction and the time of treatment, a number of items. So it makes it very difficult to explain or to show you a graph of some of the data, but I'm going to show you an example. It's not to be interpreted as final data. It is an example based on that model. But this is from the data. It's real. It's just that it's not just the data. So what this is the a repetitive behavior scale, which is a parent-administered questionnaire, total score. And the orange bar, I guess it is the placebo group, and the green bar is the CBD group. The left-hand graph is weeks 1 to 8, and the right-hand graph is weeks 12 to 20. And what you can see is that between week 0 and week 8, or baseline in week 8, there was a big drop, and that means an improvement, actually, in the scale. A big improvement in both groups, in the placebo group and in the CBD group, meaning there's a pretty impressive placebo effect. So we see it in the first 8 weeks, we see it in the second 8 weeks, a big placebo effect, but over and above that, there is a bigger CBD effect. So actually CBD did cause a significant reduction in repetitive behaviors and these problem behaviors in both the first 8 weeks and the second 8 weeks of treatment, above and beyond what you would see with a placebo. So there is an effect. For this particular graph, it's about twice as big as an improvement with the CBD as with placebo. And then this is looking at CBD levels and the score on, is this the repetitive behavior scale? And showing that children who had the lowest amount of CBD in their blood on the left, there was no difference between scores at 0 and 8 weeks. Children who had intermediate levels had a difference, a significant difference. The p-values, I hope you can see. And then on the right, there was also a bigger difference after treatment with the highest levels of CBD. So the data analyzed so far do indicate a large placebo effect. And this, I only showed you one test because, as I said, these are all being analyzed now. But we're seeing a large placebo effect in caregiver reports, and we're seeing improvement in behavior problems, including self-injurious behaviors, repetitive behaviors, and stereotypic behaviors, but a larger effect with CBD group than with placebo. And possibly the effectiveness may, at least in part, be depend on the dose and how much actually gets into the blood, because the absorption rates can be different depending on a lot of things. And then one final interesting little bit of information related to possible mechanism of action of CBD. And this is from our MR spectroscopy study. So we did neuroimaging, or we attempted neuroimaging on all of the children. It's very difficult to do neuroimaging, as you can imagine, on children with significant behavior problems. They're not sedated, of course. And so we were able to get useful images in about half. And we did structural imaging looking at what the brain looks like, and we also did spectroscopy looking at different brain chemicals. And this is just one of them, myoinositol. And myoinositol is a chemical in the brain that's thought to be a marker of neuroinflammation. This is no CBD on the left and CBD on the right, so placebo and CBD. And in the presence of CBD, the myoinositol levels are lower, suggesting that there may be less neuroinflammation, and that is may be relevant to the brain, the underlying mechanism by which CBD may help. So this is just the beginning. There's tons of data to analyze, and we are already excited about the findings and hope we continue to be excited the more we do. Lots of people to acknowledge, the research staff, the imaging people, statistician, CMCR, Center for Medical Cannabis Research, which the study is housed at UCSD. And the funding was from the Norda Foundation and Holistic Foundation, Greenwich Biosciences, GW Pharmaceuticals, and Jazz Pharmaceuticals, all the same group, provided Epidiolex and placebo, no other funding, but just the drug and the placebo. And I really appreciate the families who participated in the study. It was a lot of work for them. Thank you.